E. Good afternoon, Miss. We are group 17. We are going to present the prediction of diabetes. I'm Yung Keat. My member are Tristan and Leon. Next slide. First, I'm going to explain about the introduction. So what is diabetes? Diabetes is a condition in which blood glucose, often known as blood sugar, is too high. Blood glucose is your primary source of energy. Insulin, a pancreatic hormone, promotes glucose absorption into cells for utilization as energy. So diabetes is classified into 3 types, which is type 1, type 2, and gestational diabetics. Type 1 diabetic is mostly typical diagnosed in children and teenagers, but can affect at any age. People with this illness must take the insulin daily. Besides, if you have type 2 diabetics, your body does not produce or use insulin efficiently. This kind of diabetic is more prevalent among middle-aged and elderly people. Diabetics type 2 is the most common. Lastly, the gestational diabetics will develop when some women will experience gestational diabetics when pregnant. This kind of diabetics normally disappear once the baby is born. Next slide. Next, I will explain the diagram of taxonomy mapping. From the diagram, we can see that type 1 and type 2 diabetics have the same symptoms such as increased thirst, frequent urination, fatigue and weakness, extreme hunger, and blurred vision. The highest risk of getting type 1 diabetic is high-age people and people who develop type 1 diabetics in their family history. For type 2 diabetics, people who are overweight or had developed pre-diabetics and even women that develop gestational diabetics will be the highest risk. Lastly, the treatment for type 1 and type 2 will be different, which is insulin injection. Carbohydrate counting is the treatment for type 1, and people who develop type 2 diabetics have to change their lifestyle or take insulin daily. Next.
Thank you, Yongke. I will now talk about the problem statement of our group. The best way to prevent diabetes is to maintain excellent hyperglycemia management. Compelling administration of hyperglycemia acts in the prevention of the diabetes, turns of event and movement of a microvascular enterogram. Diabetes and associated complications can be reduced by providing effective integrated care such as education and support for patients and their families, as well as early detection of difficulties. Diabetes and its complications can cause major problems for those affected and their families. They place a tremendous burden on healthcare administration. The Association of Administration for the Consideration of People with Diabetes is complex and encompassing medical clinic, best diabetes group, neighborhood administration, critical consideration, patients and their families. The best solution is to educate people about the dangers of diabetes at early stage. Government and political parties should take care of it by giving speeches or talking about preventing and treating people who currently have it. Furthermore, reducing sugar and carbon emission is critical. It is preferable to apply all these measures as soon as possible to raise awareness among all stakeholders about the importance of diabetes and to educate them on all aspects of the disease. Diabetes has placed an undue strain on everyone. Its leading cause of blindness, renal failure, heart attack, stroke, and amputation of lower limbs. The greatest approach to avoid diabetes include a good diet, frequent physical activity, and a well-educated attitude. I will pass it to my next groupmate to continue.
I will be explaining about the research question. So first, what is diabetics? Diabetics is a chronic condition that impairs your body ability to turn food into energy. The bulk of the food you eat is broken down into sugar and absorbed into your bloodstream. Your digestive system is prompted to release insulin when your blood sugar levels are high. Next question. So what is the contribution? Diabetics has resulted in few million fatalities, the most of which are due to cardiovascular disease. Large clinical investigations have demonstrated the significance of strict diabetics management from the start in order to avoid long-term microvascular and macrovascular problems. Diabetics education provided by a multidisciplinary teams of doctors, nurses, nutritionists, and others. It is an important tool for ensuring effective behavior change and overcoming barriers to self-care. The third question will be, who is having the highest risk of having diabetics? The following are some of the known risk factors, which is family history, which any family members have type 1 diabetics. Other than that, age is a main factor because at any age of human will be getting diabetics, but it's more likely developed with adult. For type 2 diabetics, there are a risk of getting it with some factor, which is having pre-diabetics, overweight family members, having type 2 diabetics, and had gestational diabetics. The last question will be, how does type 2 diabetics develop? Insulin resistance or the inability of insulin to act correctly is considered to be the cause of type 2 diabetics in young individuals. Next slide. Our research objective will be investigated, and the result will found on research paper. So first, based on the diabetics prevalence trends in the United States research paper, we're able to analyze the number of diabetics patients each year. Diabetics prevalence increased from 4.9% in 1990 to 6.5% in 1998, a 33% rise. Both sexes, all ages, all ethnic groups, all education levels, and nearly all states saw increase. Conclusion, diabetic is becoming more prevalent in the United States. Next will be the research paper named Diabetics in Asia. The prevalence of type 2 diabetics has significantly grown. Diabetics strikes Asians at an earlier age than it does white people. Therefore, the disease morbidity and mortality as well as its complications are more frequent among young Asians. Besides that, the research paper named Diabetics and Endocrinology shows that in last 20 years, the number of persons diagnosed in diabetics has more than doubled globally. The rise of type 2 diabetics in children, teenagers, and young people is one of the most concerning aspects of this fast growth. Lastly, the research paper named Diabetics Advance in Diagnosis and Treatment shows that chronic illness have surpassed infection disease as the leading cause of early death throughout the world. There are ways to reduce the burden of microvascular and cardiovascular disease, improve glucose control, improve management of other recognized risk factors of diabetic complications, and more effective treatment of cardiovascular disease and microvascular consequences have given person with diabetics a more positive perspective. Next. The summary of our research questions and objectives will be, type 2 diabetics is increasing every year, and there is no 100% perfect treatment for diabetics. All three type diabetics will have different symptoms and illness. Lastly, all medic people are finding the right cure for diabetics. I will pass it to the next member. Thank you.
I will now talk about the data acquisition of our group. First, data is identified with use case. The data are primarily used to investigate whether the patient show the signs of diabetes, identify to the primary body index that will lead to diabetes. The second one is then the third one is develop a machine learning algorithm which can be used to predict if the patient will have diabetes based on the body index. The second one will be the prospect of the required data. Our data consists of 768 data regarding prediction based on diagnostic measurement whether a patient has diabetes. All patients here are females at least 21 years old of Pima Indian heritage. A review of the public attitudes about diabetes may be conducted, and a regularity pattern of thinking can be projected. To know about how each of the attributes affect each other. The third one, consider the qualified data. 15 articles regarding diabetes and report were reviewed before conducting the research dataset. The dataset retained columns such as sex, age to allow further data taxonomy if required. The fourth one will be consider the ethical issue of the data. As the dataset used was through the National Institute of Diabetes and Digestive and Kidney Disease, the objective is to predict based on diagnostic measurement whether a patient has diabetes. The usage of the data require official permission and legal documentation if need. The dataset construction maintain absolute anonymity for everyone. The dataset do not provide any sensitive personal information such as name, identification, number, details, and others. Hence, the data can be utilized and published with no ethical issue. The next one will be split the data for training. Data are split to training and testing on pregnancy, glucose, skin thickness, BMI, diabetes pedigree function. This data were used to find factor through conditionally probability to predict whether the patient has diabetes. The last one will be the semantic analysis of data sets. Columns. It consists of pregnancy, glucose, blood pressure, skin thickness, insulin, BMI, diabetes pedigree function, age, and outcome class variable. I will now pass it to my next groupmate to continue.
Thanks, Leong. For this section, I will be showing some data pre-processing before developing our machine learning model. First of all, from the figure, we can observe that the dataset contains 9 columns and 769 rows. The columns are pregnancies, glucose, blood pressure, skin thickness, insulin, BMI, diabetes, pedigree function, age, and the outcome. The data types in the columns are all numerical values. The table also shows that there are no any null values in the dataset. Next. Although there are no any null values in the dataset, all attributes except diabetes, pedigree function, and age contains 0 values. As a living human, the variables such as glucose, blood pressure, skin thickness, insulin, and BMI should not be 0. Therefore, those 0 values in these attributes are replaced with their respective mean value of the columns. Next. The figure shows that the attributes are replaced with the mean values. Next. From the histograms, we can see that the glucose, blood pressure, and BMI attributes have the normal distribution. Most of the women in the dataset have low number of pregnancy and diabetes pedigree function. Moreover, their age fell between 20 to 30, and most of them do not have diabetes. Next. There are a total number of 9 attributes in the dataset. However, not all of them are related with diabetes. Therefore, from the heat map graph, we can see that the glucose, BMI, age, and the pregnancies have high correlation score of 0.49, 0.31, 0.24, and 0.21, respectively. Attributes with high correlation score are selected to train our machine learning model, and that's the end of the data pre-processing. Next, we will be moving on to the model development section. The machine learning models that will be used to predict the diabetes are decision tree, care nearest neighbor, and naive Bayes. These models are selected because they are supervised classification machine learning models. The classification models are suitable for dataset given in the report because our target is to predict if a person is getting a diabetes, while 1 shows the sign of diabetes and 0 shows the signs of not having diabetes. Therefore, these classification models like these are used to predict the outcome and compare to determine which one has the best performance. Next. After fitting and testing the dataset to our selected machine learning models, the results are stated in the table. The overall performance of the selected machine learning models are very similar. From the classification reports, KNN and naive Bayes models have the very similar accuracy score of 0.6768 and 0.775 respectively. Both KNN and naive Bayes models are higher than decision tree, which only has the accuracy score of 0.68. Nevertheless, we will still be looking at the score of recall to better determine the best model. Recall is a performance measurement derived from confusion matrix that calculates how many of the actual diabetics the model can predict among all the observations the model has labeled as diabetics. Predicting disease such as diabetes will result in high cost if the model fails to predict diabetics or has high false negative. Therefore, the higher the score of the recall, the better the model we are looking for. In this case, Both KNN and 9 base has the same weighted average score of 0.77. As a conclusion, we decided to choose 9 base as the best model in predicting the diabetes, as it has the highest accuracy score of 0.775. Now I'll pass it to the next member.
I will talk about the limitation and future study. The limitation of this research is that a coordinate dataset has been chosen at this point, but at the later stage, unstructured data will additionally be considered, and these strategies will be applied to other clinical regions for estimation. For example, for various types of harmful development, cirrhosis, and Parkinson affliction. Various factors, for example, true toxicity, diabetes family history, and smoking proclivity must also be addressed in the future for diabetes assurance. Furthermore, the missing qualities might be a component, and the absence of a fragment or a substantial pieces of data could restrict its utility. I will now talk about the conclusion of our research. Diabetes is a slow killing sickness with no known cure. Its problem though can be resolved with enough awareness and a quick therapy. 3 actual outcomes are visual impairment, kidney damage, and coronary failure. To avoid problems, it is critical to keep patient glucose level under strict supervision. One difficulties with extreme administration of glucose level is that such initiatives may result in hypoglycemia, which produce indisputably more actual outcome than an elevated quantity of blood glucose. Machine learning and data mining technologies can be used to diagnose illness. The capacity to detect diabetes at early stage is crucial to determine the best treatment plan for the patient. The accuracy of several existing medical diagnostic categorization methods for diabetes patients was investigated in this study. Classification issues are discovered in the accuracy expression. These findings are significant because they can help people to learn about how each of the traits affect each other. That's all for our presentation. Thank you.